Good morning, good evening, everybody. I am Vaidya Asavari Manvikar. I would like to welcome you all for GCAR Global Webinar Research Series. GCAR is Global Council for Ayurveda Research. So it is an international non-profit organization based out of USA. Our mission is to educate, encourage, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all of our resources. No nonprofit can work and operate and succeed without volunteers. So consider joining us as a volunteer, and we can place you in a variety of projects based on your skills and your interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce you to our eminent speaker today. His name is Dr. Rajnikant Patel. He is BAMS, and he is a distinguished Ayurvedic physician at Agnivesh Ayurved Hospital in Surat, Gujarat, in India. He is a graduate of Atreya Ayurved Medical College from Bangalore. He has been practicing Ayurveda since 2014 with a strong focus on Panchakarma, complex and difficult to treat conditions like cancer, autoimmune disorders, and neurodegenerative diseases, rehabilitation, and rejuvenative care. Dr. Patel is internationally recognized for successfully treating over 1,500 cases of black fungus, mucormycosis, using stand-alone Ayurvedic treatment. The work that has been featured by BBC News and presented at international conferences in Taiwan as well as in India. He has authored multiple published case reports in peer-reviewed journals and serves as an international consultant for leading Ayurvedic organizations, including Jiva Ayurveda and Easy Ayurveda. A sought after speaker and educator, Dr. Patel has delivered lectures on clinical Ayurveda at universities and medical institutions in India and United States. Today, he will be speaking on Ayurvedic cancer care, a geriatric lung cancer case with liver cirrhosis, 1 year follow up. I would like to welcome you back, Dr. Rajnikant. Last time also you delivered a wonderful lecture, and all of our attendees are looking forward to hear you back.
Okay. My slides are visible.
Yes, they are.
Audible, am I?
Yes, you are.
Okay. So thank you very much, madam, for the warm welcome. And I would like to thank you and Dr. Pratibha Shah, madam, for inviting me to this GCAR series of lectures one more time. And I remember, I think it is almost 1 year ago, we had a lecture in the same platform, if I'm not wrong,
That's
right?
absolutely right. Yes,
Yes.
absolutely right.
So the cancer care in conventional science as well as in Ayurveda is a very interested topic for the research and for all the clinician as well, because the cases are being rising too much everywhere, and sometimes we say that half of the our OPD we see only cancer patient from morning to evening, right? So it is
Mm-hmm.
like a pandemic. So understanding this disease from Ayurveda perspective and also sharing the clinical evidence of Ayurvedic physician with other Ayurvedic physician is very much important because cancer is a kind of disease where it teaches every new thing with each case we treat. It's not like other disease that one protocol can work for all. But the cancer is a very tough this thing to see to how to approach, and we don't know next day morning what will happen to any individual cancer patient, right? So here I will be sharing a case of a single case study I will be sharing in this class. The patient is an old age patient. He was diagnosed with a lung cancer along with liver failure, and we have treated him. Currently also we are treating him since more than 1 year, and he is living normal life. So we will see how he was diagnosed and how we have treated and what are the radiological evidence and clinical evidence that we have generated in this case. So role of Ayurveda in a cancer care, a single case study of a geriatric patient having a lung cancer with liver cirrhosis or a liver failure with 1 year of follow-up. So before I start my presentation, I I would like to tell that I highly believe that the thousands of years of human observation and trial and error are always greater than the 6 months of rat experiments in the lab. And that is what our Ayurveda says, right? So we must respect our Samhita and Shastra, all the Lagutris and Bruhatris. So unless and until we don't dig the Samhita deeper, we cannot achieve a diamond from it, right? So if we want to get something really useful, we need to read, understand, and Samhita in very deep level. Then only we can get something very good out of the Samhita. Just reading and by hearting and translating the Samhita and all these things is not going to help, right? So we must respect, learn, understand the Samhita to the deepest level. Before going to the case, we must know that it is not a simple disease. Cancer is a complex disease, and what I teach to my students that the disease which we have in Charak Chikitsa Sthan from third chapter to 38th chapter, from Jora Chikitsa to Atharva Dosh and all these things, right? So all those disease can be clubbed under a cancer, right? So we have Jwara Chikitsa, the cancer can be there. Raktapit Chikitsa, cancer can be there. Rajayakshma Chikitsa, cancer can be there. Unmat, Apasmar, Grahani, Atisar, Vat Rakt, Vat Vyadhi. All these disease can be clubbed under a one broad name as a cancer. So it is a very much complex disease and it involves almost all the systems of the body, right? So also every case teaches us something new always, and each patient expand our understanding beyond the textbook and the protocol, right? So cancer is not a disease where you can follow the what is being written in the textbook or what is being told in the protocol. That is a side, and when we see the patient, it is totally different, right? So we must understand that it is a very complex and a severe kind of disease. Each case has something new to learn for a clinician. Each case teaches us something new thing for specific type of cancer, and each patient that we treat, which expand our understanding beyond the textbook and the protocol, right? So this was a patient I had before 1 or 1.5 year ago, and he was brought into the wheelchair. He was not able to walk. He was having extreme drowsiness. He was not able to give proper history, and their family member gave the history because he was in that much mother avastha, right? So 76-year-old male, a diagnosed case of lung cancer with a liver failure. He came to us with a complaint of severe loose motion, approximately 10 to 12 loose motion, severe facial edema and bilateral lower limb edema, and he was having the parshva flank pain, and the pain was such a severe that he was not able to lie on either side. Also, it was associated with nausea, vomiting, and total loss of appetite. So this was the clinical presentation when first time I saw this patient. On that day, I checked the report. His bilirubin level was extremely high, 13.18 milligram per deciliter, and PTINR ratio was 2.71. So this two figure itself is a life-threatening condition because when bilirubin is 13.18 mg per deciliter, that too a case of lung cancer with severe edema, that too in 76 year of age of patient. So this was like a life-threatening condition for him. And before coming to our center, Ayurvedic hospital, he was admitted to a conventional medicine setup. And there they tried everything and but couldn't succeed in giving a satisfactory improvement to the patient. So they told that we don't have anything to offer in this case, as the patient is having a liver failure also and lung cancer also. They cannot initiate a chemo or radiation, or they cannot treat liver failure without focusing on lung cancer. So they were exhausted with their resource, and the patient were being advised that family member that you take this patient to the home and you do the seva. I mean, let's see how many days he survive. You please take care of him at the home, and we don't have any treatment to offer in this specific case. In that time, somebody referred here to check whether Ayurveda can do something in this case or not, right? So as I told, the patient was brought to our hospital in the wheelchair. So the patient was brought to our hospital in a wheelchair with a severe generalized edema, and patient's skin color was extremely black all over the body, from face to ankle joint or the thumb of the finger of the lower feet. So it was extremely blackish discoloration on the body. And when we see such patient in our clinical setup, the first thing should click in our mind is it is a severe aggravation of Vayu. It is the extreme level of Vata Prakopa which patient is suffering from. Because when we see the shloka of Vata Prakopa, Karshya Karshne Ushna Kamitvam Kampa Anaha Shakrudgrahan. So Karshya and Karshnyata is the first word where the Vata Prakop shloka starts, right? So the underlying state was suggestive of Vata Prakopa associated with Dhatu Kshay. So either Vata Prakopa caused due to the Dhatu Kshay, or first Dhatu Kshay was there and due to that Vata Prakopa was there, right? So in this case, Dhatu Kshay here we can consider as the Kshaya Avastha or Kshatakshina Avastha of the this Fufus or the Pranava Srotas Dushti. So this immediately after seeing the patient, I came to conclusion that this patient is having a extremely Vata Prakopa without knowing his history or anything. Just by observing that he was, because that color is not a natural that we can say easily that whether this blackish discoloration of the patient is natural or not. Also, there is a severe compromise at the state of Agni also, because the function of Agni starts with a Kanti, Oj, Deh, all these things. So the Kanti is not maintained in a patient. So we say that Agni is also near to get diminished, and the death is very near for this patient because extreme Vayu Prakop, the patient lost the tej on the face. He looks very dull or udas, or what we say, there is a word in Sanskrit, I forget. But we look that patient means we can say that death is very near for this patient if he not treated properly, right? So in 2025 April, he was admitted for 4 5 days, and here you can read the discharge summary of that hospital. That patient was diagnosed with a lung malignancy, with a cirrhosis of liver, with a collapsed vertebra. So there was a suspicion that he might have a bone metastasis as well, because the bone metastasis to the vertebra may cause the pathological fracture and then collapse of the D11 level vertebra. So the here we can see the 76-year-old male patient was admitted to that hospital with pedal edema since 2 days, loss of appetite, weakness, difficulty in passing urine since 2 months. He was having diarrhea since 5 days, and he was admitted to another hospital for 2 3 days. And there they misdiagnosed this case as a pulmonary cox, and they started the treatment. So the medical history was nothing significant, only AKT they have started, and all the vitals were near to the normal. Then the patient shifted in ward for further management, and treatment started with all this antibiotic, antacid, anti-emetic, intravenous fluid, and AKT was holded because of the injury to the liver. Meanwhile, they did the CT abdomen and chest, which was positive for the solid and necrotic mediastinal and ciliary lymph node. So here they suspicious first about the malignancy presence. Lymphadenopathy was there, and they confirmed that it is more of a malignancy than the infective this thing like TB. And also the liver show the changes of cirrhosis without sign of biliary obstruction. So with this, the reference was given to the gastroenterologist for further this thing, and they have managed all these things, but couldn't get the positive outcome. So they discharged to the home with a poor prognosis. So that time patient came to us, and this is the CT scan report. So here also you can see the right perihelial lesion with mediastinal lymphadenopathy, which was positive for the malignant etiology more than the infective etiology. Also, the compressed fracture of D11 vertebra and liver was having the changes of cirrhosis without the obstruction into the biliary channel. So this is the brief about the his blood investigation when he came to us on 27th April 2025. The bilirubin was 13.8, PT was 28 second, INR was 2.71. So this is an extremely dangerous case because of severe jaundice and coagulopathy. Patient has lung cancer, compressed fracture of vertebra and liver failure, 13 bilirubin. So after 2 days of Ayurvedic treatment, the report were done, which shows 12.59, 14.1 second PT, and INR was reduced to 1.31, which was near partial stabilization within 2 days of treatment. Then further on 1st May, we repeated the same thing, which was showing more further improvement. Then on 8 July 25, the almost all the parameters were near to normal. And interestingly, last Sunday only the patient visited to the hospital for follow-up, and they came with all the liver function test, kidney function test, complete blood count test, and all these things. And liver function test is absolutely normal. SGPT is normal, SGOT is normal, alkaline phosphate is normal, albumin normal, bilirubin, direct, indirect, everything is normal, right? Also, kidney function test is also normal in last Sunday, that is 24th May. So more than 1 year of follow-up where the patient was discharged from the hospital saying that there is nothing to offer from our field to treat this patient. Patient came to Ayurveda and still living normal life without any dependency. And on first visit, he was brought to our hospital in the wheelchair. He was not able to walk, talk, too much drowsiness, extreme edema. Water was leaking from the lower limb due to extreme edema. And now he himself is coming with a stick, walking without anybody's support, climbing the first floor and coming to my OPD and showing to for the follow-up every month. And if you see this patient now, nobody can tell that this is the same patient which we saw before 1 year when he was came to our hospital on the first visit, right? So that was about a clinical improvement and the bio this blood parameter what we have seen the improvement, right? So in January, I advised to go for a PET scan, position emission tomography CT scan to see the actual status of the malignancy, whether it has spreaded to the another system, invasion is there or not, and to check whether is there any regression in the tumor size or not, right? So here you can see the 19 January first photo is the latest PET scan 19 January 26 and the earlier was 28 April 25. So there is a interval regression in the extent of right pleural effusion and now mild pleural effusion, interval resolution of the left pleural effusion. So this is very hard in conventional science in most of the case to stabilize the pleural effusion, formation of pleural effusion. because if they remove the pleural effusion with the pleural tapping, after 2, 3, or 4 days, again the fluid will build up and they need to again remove the pleural effusion. Once this process continues for 3, 4, 5, 6 times, they will put the intercostal drainage, and patient will have to move with a drainage fitted into the thoracic cavity, right? But with Ayurvedic treatment, in last one and I think 13 to 14 months, patient didn't require a single pleural tapping to remove the pleural effusion. So that is the significant achievement with Ayurvedic treatment in this case, right? And the PET scan also showed that there is now very mild pleural effusion and interval resolution of the left pleural effusion with the Ayurvedic treatment. Also, we have noticed some increased in the size of some of the lesion and some of the lymph node involved. So there were a few sub-centimeter size lymph node which was there at a bilateral supraclavicular region, showing the faint metabolism and also showing the marginal interval increase in the size. So earlier, before our treatment, it was 6 into 6 millimeter with SUV max of 2.2, and after our treatment, more I think 8 and 11 January, so 9 months, it was increased only up to 8 into 7 mm. So little mild increased in the size. So given in this case where patient is having 76-year-old liver failure and lung malignancy, this lymph node would have now progressed to 2, 3, 4 centimeter of size. That's what we see in the general patient. But this patient almost stable in the size, we can say 6.6 centimeter, and now it is 8.7 centimeter. So it was done in the January, and now it is May is getting end, June is starting, right? So we will repeat the PET scan again after 2 to 3 or 4 months, and we will have more data on this specific patient. Also, there is a ill-defined heterogeneously enhancing soft tissue lesion noted in the right suprahiliar region, measuring approximately 29 into 20 mm with 16 SUV max uptake. Previously, it was 14 into 19 mm. This increased, I think, double 14 into 19 mm, and now it is almost 29 to 20 mm, right? But patient doesn't has any clinical complaint related to this. So this was the negative finding in this patient, but still we can say it is a good one because in this much time period, this is not worsening to a serious condition. There was fibrocalcified soft tissue into the right upper lobe lungs. Measure it was earlier 26 into 16. Interestingly, here is the important thing. Previously, also it was the lesion tumor size was 26 into 16 mm. Now also it is 26 into 16 mm. So in this specific case, we can say that Ayurvedic medicine might have successfully stabilized the cell division in this tumor. And the similar inhomogeneously enhancing soft tissue involving apical segment of the left upper lobe. That was 226 into 16 is a right lungs. This is about the left lungs. So here previously it was 24 into 18 mm, and now it is 26 into 22.4 mm. So little bit 5 to 10% increase in the size of lesion in the left lungs, stable size in the right lung with Ayurvedic treatment. Also, there were multiple heterogeneously enhancing necrotic lymph node at bilateral prevascular, anterosuperior mediastinum, subcranial, hillier and perihiliar, paratracheal beneath the lower intrathoracic esophagus and GE junction region. The largest in this was left suprascavicular component measuring approximately 16 to 13 mm. Previously, it was 12 to 12 mm. The lymph node along the intrathoracic esophagus now measures 17.16 mm. Earlier, it was 16.16 mm. Also, the nodal tissue at subcranial region showing interval spec of calcification measures 27 into 14 mm. Previously, it was 14 into 10 mm. So all this place, we see that disease is successfully stabilized in majority of the area. There is no new lymph node invasion. There is no new lymphatic invasion. no new bony metastasis, nothing is there in this 8 to 9 months of Ayurvedic treatment. Generally, the patient will have worsening condition in the PET scan. If we see there will be a metastasis to the intestine, stomach, it may go to the head and neck area, it may go to the cervical or thoracic level of the vertebra and spinal cord and all these things, right? This was about the ascites. There is a significant regression in the prior noted ascites and now minimal fluid in the pelvis. Now, in this also, as I told that the patient might need a multiple thoracic tapping for the pleural effusion because the day they tap the fluid, again 2 3 days later, the again 1 or 1.5 liter fluid will accumulate and they have to continue tap. Same thing happens with the ascites. Once they do the ascitic tapping, after 2 3 4 days, another fluid will accumulate and again they have to do the tapping. But in this case, neither ascitic tapping nor a pleural tapping was required in last 14 to 15 months. That too on standalone Ayurveda treatment, right? Also, there is a mild interval regression in the extent of right pleural effusion and now only mild pleural effusion. There were interval resolution of the left pleural effusion. So these are the CT scan radiological images of before our treatment and after 8 months of our treatment. Now, interestingly, the radiologist gave a report that these findings are suggestive of a mixed response of the treatment, right? So this kind of PET scan we generally see when a patient is receiving chemotherapy and radiation therapy or parallelly with maybe immune therapy or a targeted cell therapy. When they go for a PET scan, they write that it is a mixed response to chemo, radiation, or all these things. Now, but this mixed response of the treatment is belongs to 100% of Ayurvedic treatment because patients were not introduced to chemotherapy, radiation therapy, or nothing. Only Ayurvedic treatment, and the radiologist told that there is a mixed response to the disease by the Ayurvedic treatment, more like, right? So this was the PET scan report, and after a few months, we will have another PET scan to generate a more evidence that Ayurveda works good when there is no option available in the conventional this thing. As I told, the patient currently is living a normal life without anybody's support for his day-to-day activity like walking, eating food, passing stool and urine. He alone is now, he is also going for a walk in the garden without anybody's support, right? So this is the latest condition of the patient. Now, coming to the medicine, these are the medicine which were used in this treatment in this time. This medicine were not used at a time when the, for example, Kutaj Ganvati was used in initial day when he was having more loose motion. Once the edema was controlled, Dugdhavati was taken out from the prescription, right? Like that. So Dugdhavati we have used orally and Pushkarmul, Punarnava, Vacha, Karkat Shungi, Lep we have used on the chest for the drying up of the pleural effusion. गोक्षूर चूर्ण दुषी विषारी गुलिका सुवर्ण वसंत मालिनी रस सर्वेश्वर परपटी रौद्र रस सर्दी रिपुवटी कुटज घनवटी and पिप्पलयादि अनुवासन तैला for Abhyanga on Udar Pradesh. As I told, these all medicine were not used at a time. Depending on the clinical condition, doses were increased and reduced and stopped. Right. So Kutaj Ganvati has only Kutaj and Ativish in it. It is from Siddha Yoga Sangra. It was used as a Vyadhi Pratyanik Chikitsa because if patient is not there, whom we will treat. It is not like that in this condition you need to focus on Dipan and Pachan and Kosha Shuddhi and all. We don't have that time in this kind of patient. You forget that. Immediately you attack on the disease, protect the life of patient. Once patient is stable, then you can focus on Agni and Kosha and whatever you want, right? So in initial stage where the life is in danger for any specific patient, especially while when we deal with the critical cases, we must directly focus on to the pinpoint treatment, precise treatment, Vyadhi Pratinik Chikitsa, Kutaj Ganvati to immediately stop the loose motion. Because we have a reference in, I think, Charak Samhita that the stool or the Purusha of a Raj eczema patient should be protected because the strength of a patient or the bala of a patient or ojas or all these things what we see in Ayurveda stays in the stool of a patient. If patient continuously passing stool for 10 to 15 to 20 times in a day, Agni, Vayu, Som, Oj will leave the body and patient will be a Panch Mahabhautik body. There is no Atma in it, patient die. Right? Dugdhavati from Bharat Bheshaj Ratnakar, it is indicated in Shoth Rog. It has only Hingula, Shodhit Dhatura, and Shodhit Vatsanap. Right? Sarveshwar Parpati, it is indicated for the Arbut Sardi Ripuvati to stop the gastroesophageal reflex, to stop nausea and vomiting. Because of the cirrhosis of the liver, the patient might have the increased portal vein pressure, hypertension that might press the GE junction, and vomiting and all this thing will be there. To stop that, we have used Sandhi Ripuvati, right? Also, when I tell the name of medicine, Ayurvedic physician must keep one thing in their mind is it is not the medicine which is treating the patient, or it is not the medicine which is healing the patient, or it is curing a disease. It is a principle which is more important, and principle is only treating the patient or healing the patient. Because not with Dugdha Rasa, Suvarna Vasant, all the same medicine you can treat the same patient, right? So the yukti behind using all this medicine at a specific time in specific dose, that rational thinking is very much important while dealing with such a critical patient, right? Also, from an Ayurveda perspective, the involvement of Rakta Dhatu and Lasika Dhatu appears to play a significant role in the process of metastasis. Because since the lymphatic system and the blood circulation are only the principal pathway which will help malignant cell to spread to the nearby structure or the distal part of the body, right? Now, the vitiation of Rakta Dhatu and Lasika Dhatu may facilitate or it may worsen the speed of disease spread if the Rakta Dhatu and Lasika Dhatu's function are compromised, right? Also, Lasika can be compared with a lymphatic fluid or a lymphatic channel or this thing, and Rakta with a circulatory system. Now, maintaining the equilibrium of the Pitta dosha and preserving the integrity of this dhatu may be an important therapeutic consideration in limiting the metastatic progression, right? So these are the like checkpoint. So if you maintain a healthier quality of Rakta dhatu and Lasika dhatu, the chances of malignant cell spreading or invading to another distal organ is we can reduce, because we know that principal pathway for malignancy to travel is lymphatic channel only and the blood circulation. That is the site of Prakruta Pitta dosha according to Ayurveda. We know the Tatra Asthini Sthito Vayu Pittam Tu Sveda Raktayo, right? So the Pitta resides in Rakta Dhatu, and Ashtanga, I think Ashtanga Hridaya or Sharangdar says that Lasika is the sthana for the Prakruta Pitta to stay, right? So all the cancer patient must receive the Pitta Shaman Chikitsa to maintain the integrity between the Rakta Dhatu and Lasika Dhatu, and which helps in spreading the cancer further. Also, in our practice, we generally advise cancer patients, especially when there is a multiple metastasis, we ask them to take only milk only diet for all the patients, those who can tolerate. And this is the observation from my practice that the patient who choose to be on milk only diet shows the very good amount of recovery and very good quality of life. Even though the patient has so many, many system involvement, like there will be metastasis in the brain, metastasis in the lungs, metastasis in the bone, metastasis in the liver, femoral bone, lumbar region, everywhere. But if patient is taking milk only diet, when I talk milk only diet, it means patient should not take even a drop of water, no food, no dal, rice, chapati, nothing. 100% milk, right? We also know that the milk has the 10 quality, which is opposite to that of Visha quality, right? And we also have the reference where we can say that accumulation of too much of Dushivish and Garvish might force the signaling pathway in the DNA or gene or the nucleus to divide more uncontrolled manner. So if we get success in removing the toxicity level or the Visha level from the body, there is a good chance that patient lives a long and a good quality of life, even though with a metastasis present in the body. Because when we give the milk, it is going to increase the 10 quality of the ojas. Now the 10 quality of the ojas increase, by default there will be reduction in the 10 quality of a Visha, right? So this Visha Chikitsa, if you would have seen in the treatment, I have add the Dushi Vishari Gulika in this, right? So most of the case, I will be using Dushi Vishari Gulika or Shirish Churna we will giving or Shirish Panchanga ghee we may give, Vilvadi Gulika we may give all these things, right? So there are multiple approach where we have to see. And as I told in the earlier that cancer is not a single for this disease. It is a very complex term. And so many all the disease in Ayurveda can be fit under the cancer, right? So here patient has a atisar, breathing problem, edema, shoth is there, pandu is there, kamala is there, grahani is there. So Vat rog is there, right? Vat vyadi. So many area we have to focus at a time when we deal with a cancer because there will be multiple organ involvement, there will be all this agni, purush, mutra, nidra, all these things are disturbed, right? So it cannot be a single disease where we focus and we get a treatment, right? So based on the patient presentation, whichever is more dangerous for patient's life, we focus more on that. Then simultaneously we give a lesser amount of treatment for parallel this issue, right? So this was about this case of more than 14 to 15 months of follow. He was about to die, now living a healthy and normal life with a clinical improvement is there, and also we have a radiological improvement in the form of PET scan data, and we have a normal kidney function and liver function test in this case. So this was about a single case study. Thank you very much for listening. Thank you.
Thank you so much for excellent case presentation. This was a very critical case, and you explained it really very well and treated it, when the patient was in a very difficult situation, in a critical condition. Uh, I would like to see if any of these attendees or participants have any questions for Dr. Rajnikant Patel. Okay. I have a couple of questions.
Yes.
Yeah, so I'm wondering about if there was any allopathic treatment this person was receiving at the same time when he was getting all this treatment.
No, no. He was admitted two times in a hospital before coming to our center. When we started the treatment, he was on standalone Ayurveda treatment. No any medicine.
Okay,
Only
excellent.
Ayurvedic medicine he was taking.
Okay, okay, wonderful, wonderful. And were you able to find any causes? Because if you see, there are so many different health issues he is having. So there is a cancer in lungs, at the same time liver cirrhosis. So in terms of his ahar vihar or any other things or any previous diseases, or typically we find some kavaigunya because of parents' history or genetics. So did you find any of the causes?
There were no family history, and patient was, they were coming from a very religious this thing, no alcohol, no smoking, nothing, and he was a good life. But what I personally observed is the time is the cause. When we live in a 21st century where everything is polluted, even many herbs are now polluted.
Mhm.
So what I think consider time is the biggest cause or a nidana for any disease, especially in the when we talk about cancer. because that reference we already have. It is not just food and all these thing or the bad lifestyle which can cause a disease. Because majority of the patient in my state, Gujarat, Surat, where I am practicing, we see people come from a very religious background. They don't eat any bad food. I see many Jain people also. They follow all the dinacharya, rutucharya, everything, and they'll end up with all the metastasis everywhere. There is no family history, so it is very complex and very difficult to understand this disease. No doubt, we have so much of literature, published literature available that genetic changes or alcohol or smoking or all these things. But that thing is apart because medicine is a thing where theory is totally different and practice is totally different. So the more powerful data gets generated in the OPD, not in the this thing theory and all these things, right? So I don't go much deep into the finding Nidana and all these things because even though if you find Nidana, there is no way to reverse this thing, especially when we talk about cancer. Other disease, we have Nidana and patient stops Nidana, then patient get relief in this thing. But cancer is very hard to understand. I am not able to understand this disease. That's why I told that each and every case we treat, we learn something new about the behavior of the cancer cell because not all patient with the same cancer behaving similarly, right? So
Mm-hmm.
again, I am still learning the part of cancer in Ayurveda treatment. Maybe after 20, 30 years, I will be able to answer your question more beautifully.
Sure, sure, absolutely makes sense. And regarding the next steps for this patient, like, are you looking for like rasayan chikitsa, or like what will be the next steps, or looking at his symptoms and based on the symptoms, the treatment will be
Ah,
of.
Rasayana already is taking in the form of Suvarna Vasant Malini Ras, Goksu Chuna, Shila Jatu, Gugulu. We are also, but now he is only taking 2, 3 medicine because he is completely all right, even though there is a cancer is there, but nobody can tell that this patient is carrying this much cancer in his body. And also the PET scan showed that majority of the lymph node and tumor mass are very much in controlled and there is no new involvement of any other area in 8 to 9 months. This is very this thing. Rarely we see in this thing because even after chemo and radiation, patients the disease spreads to another organ within 2 or 3 months of chemo and radiation that we see,
Mhm.
and this is about 15 months of follow-up.
Absolutely, very, very promising prognosis. Excellent. Okay, I see there is one. Okay, uh, by Dr. Madan Tangavelu. Namaste, sir. So he says like it is a wonderful presentation. Are there more cancer cases you have treated in your practice?
There are many cases. Yes, we do have cancer cases, but I would like to tell about the memory of one glioblastoma multiforme grade 4. It is a very aggressive this thing, and patient lived for almost 4 to 5 years after Ayurvedic treatment. Glioblastoma multiforme grade 4, which is very strange. I mean, it is very aggressive tumor. Every 24 hour it grows its size and patient living 4 to 5 years. It was just one case, glioblasto GBM grade 4. But we do have a oral CA, esophagus CA, stomach CA case, and they do very well. I'm not telling that I am curing the cancer, but the way they are living the life is far, far, far better than the conventional science response. Like we see chemo and radiation, majority of the cases they get worsen and all this thing and this. So as I tell, we need more and more years and more cases to be treated and then come up with a stronger and stronger evidence day by day, and we may have something good to look into this.
Right, right, absolutely. Anybody else? Anybody has any questions? All
No
right.
questions.
No, that was an excellent case presentation. I mean, I'm so glad that only with Ayurvedic treatment in this situation, when the patient came, when there were no hopes for survival, you were able to treat this patient only with Ayurveda. And 15 months is a long period, definitely. I mean, it's a very wonderful success. Right. So thank you so much, everyone, for attending our webinar. And definitely, we will be actually having this recording on our YouTube channel. So please watch and subscribe our YouTube channel. Please like, comment, and share the videos as well. Once again, I would like to invite all of you to become members and also fill out our volunteer form if you are interested into volunteering. You can now also subscribe our IU Update newsletter to stay tuned with our projects and any of the events. If you have any questions, please feel free to contact us at Ayurveda Research USA at gmail.com. You can also reach out to me, Asavari at mnayurveda.com. Thank you so much. See you again
Thank you.
next.
Namaste.
Namaste.